Jeans with me this morning. I don't know if you just want to say a quick hello, Catherine.
Hi, everybody. It's really great to be here.
So, Catherine, as many of you may know, having read articles in the national tabloids and in the newspapers and online, and maybe even seen her on TV, is kindly here to talk to her about one of her particular areas of expertise, family nutrition. We're very, very pleased to have her, as I've already said. So I'm not going to rabbit on too long. I'm going to let Catherine do all of the hard work, and she's going to tell you a little bit more about herself and her background in the first few slides. So enjoy, everybody. As you can see, the chat box in the left-hand corner is there. If you can ask questions and things, I will collate those as we go, but we'll keep Q&A largely to the end, just so that we don't interrupt Catherine's flow. If anything needs to be dealt with immediately, then we can do so. But yes, enjoy, everybody, and please do ask lots of questions. We should be probably just over an hour today, and then with some Q&A at the end. So hopefully you'll find it a very valuable session. So over to you, Catherine.
Thank you, Sophie. Really great to be here today, as I said, and obviously I hope everyone can hear me okay. It's really nice to be talking to lots of people. Now, I'm really excited to be talking about this topic, which is a topic that's really close in my heart because I have my own family, and I'm really passionate about helping women, mothers to feed themselves and their families well, and to feel great generally. And unfortunately, I see a lot of women that don't feel great, as I'm sure a lot of you do as well. So what this webinar is really about, it's about the practical side of things. I certainly don't have the scientific knowledge as Nina and Sophie do, but you know, I think as many of you, I don't know how many of you are nutritionists or nutritional therapists, but my view and what I've learned in 6 years of practice is it's not just about what I know, it's how I can impart that to my clients and get really good results with them. So I've seen over 1,000 clients in my 6 years of practice, obviously not just once in them, you know, in varying amount of times. I'm just going to scroll through on slides, and I hope you're seeing the slides okay with me. So some of the things that I do, so I work one-on-one with clients. I do a lot of workshops as well, which is something I really enjoy doing, where I do cooking with people, because, you know, it's incredible, as you probably find, that so many people just haven't got a clue about food. I'm also director of the Orange Grove Clinic, and we've kind of created a bit of a bump, birth and baby centre around our work there. My business partner, she does hypnobirthing, yoga, pregnancy massage, and baby yoga. So we've got a real nice follow through of services, and we've also created a fertility team program. It's one thing I've certainly learned with working with fertility is it's great to be working with other practitioners. You know, there's so many things that we can do and there's so many things that we can't do, and it's always great to be able to have case conferences and talk about a case, and I think it's in the best interests of our clients to be doing that. So if you have a look at the Orange Grove Clinic website, you'll see our fertility packages there, which range from about 4 to 6 months for individuals and couples. And I'll talk about some of the clients that I've seen as part of that as well. So a little bit about, also I do a lot of writing as well, and the series that I've had in the Telegraph with Oldie recently, it's just about real simple changes that people can make, and I think that's something I've really learned over the years, is that, you know, I'm a big believer in functional health, but it can get very complex and not everybody wants that, and some people just want, you know, very simple practical changes that they can make, and I'll talk a little bit more about that when it comes to the relevant pages. I'm kind of trying to bring my slides to life a little bit today with some case studies as well, because I think that's one of the best learned. I remember when I was studying, and also when I go to CPD events, for me, I really like to hear about case studies, and that's something I've brought today as well. So a little bit of an overview of what we'll talk about today. I thought it'd be useful if I talk about the little bit of some of the practicalities I've learned about when working with fertility. I've learned so much in 6 years. I don't work with this group, so I certainly haven't seen 1,000 fertility clients, but I've seen a fair amount. And some of them I see once, some of them I see lots of times. And I just thought I'd give you some of my experience with that. Adrenals. We work so much with the adrenals, don't we, when we are working with clients on so many levels, and so important for fertility. I'll talk a bit about actually why I think an adrenal test is sometimes even more important than a female sex hormone profile. So we'll talk about how we might support the adrenals when someone's trying to conceive, and I've got a nice case study there that we'll look at. We'll look at a couple of the functional tests that I use for fertility as well. We'll look at what happens when a client gets pregnant. So now what does that mean? That we can't support them through pregnancy. There's a lot that we can do, and sometimes again it's not that complex stuff. It's just being there as an assurance for people, and we'll talk further about that. And I also wanted to include a little bit about postnatal recovery, and that's not even just in the 6 months after having a child. I'm starting to see so many clients around about 2 years after a child, particularly after their second and third baby, where they're just crashing. And I see it a lot, and I think it's worth covering that because it's an area we can really, really help. I know as a mum myself that we want to enjoy our children, but it can be hard, particularly when you're working, trying to run a household. And I think it's about how we support those women in a way that they can manage. And then obviously, as Sophie mentioned, we'll look at some questions at the end. So let's get started. So with fertility and preconception, I thought it would be good to have a look at some of the types of clients that you might see. This might help you in terms of how you market your services if you're interested in working in that area, but also, to really think about the person that you have in front of you. We are trained, I was certainly trained as a nutritional therapist, to be not to be using protocols and to be looking at each person in front of you as an individual, and that's certainly what you should do. But it's also quite useful just to have a little think about the kind of clients that you might see. So I see a lot of couples or individuals who are just thinking about trying to get pregnant soon, and they want to make sure they're in the best possible health. And obviously it's great if we can capture our clients at this point, to be getting into the really, really good health. There's some amazing research coming out about epigenetics and actually at the point of conception and what's happening at the point of conception and how that impacts fetus and the baby and the child throughout their life. There's some really interesting research that I saw actually a BBC documentary about the epigenetic environment around conception in some places in Africa compared to the mother when she conceived, whether it was the dry season or the wet season. It's really fascinating, and I think it's so wonderful to be able to explain to people that how they're eating now can affect the health of their grandchildren. You then also get people that have been trying to conceive for a while. Some of those don't want to have IVF either because they want to go the natural route or because IVF isn't an option for them, i.e. they may already have a child or their partner may have a child. So in a lot of areas, the NHS won't fund, say if the partner, if he already has children from a previous relationship, they won't fund the IVF for him to have children with his new relationship. So you get lots of, every area is different. Even where I live, different areas, you get some places there's 2 rounds of IVF funding, some there's 3. I get a lot of people that are about to privately fund IVF, so obviously they're going to spend a lot of money, and they want to make sure that they can help support maximise those chances of getting pregnant. I have seen quite a lot of same-sex couples actually in that category who obviously are using a sperm donor or they're using an egg donor. Had a really interesting one recently, which was a female couple, 2 women, and they wanted wanted to, they're going to have a sperm donor. The eggs were going to be retrieved from one of the ladies. She was going to donate half of those eggs, and then they were going to have IVF, and the implantation of the blastocyst in the embryo was going to be back into her wife. So one lady was given the eggs, and then the other lady was going to carry. And she's now 7 or 8 months pregnant, so the first round worked really well for her, so that's wonderful. I see a lot of people that had 1 or 2 failed IVF attempts, and they often have their last NHS funded cycle coming up. So, you know, again, anxiety around that, and, you know, worried that they won't be able to fund any more themselves. Those that have had a recent miscarriage or recurrent marriage, see those women and couples obviously concerned, and obviously have a lot of anxiety about pregnancy as well. I recently worked with a lady who'd had a stillborn, so obviously, you know, so much emotion around that. And that's where working with other practitioners can be really useful. I'm referring quite a lot of my clients to, we have a hypno-fertility practitioner who just kind of helps couples to unpick all the stress and emotion around the fertility journey. I think it's great when couples who are going through fertility problems can have things that they can do on a day-to-day basis. So food is one of them, you know, they know they're doing something, but also, you know, self-hypnosis techniques that really help to keep them calm. You know, you imagine a situation where a woman has had 2 or 3 failed IVF attempts or has had recurrent miscarriage, there's always going to be an anxiety there, and we know that that's not going to help in terms of success. Again, I see a lot of women over 40 as well who really feel it's their last attempt to have a family. They may not be eligible for IVF funded, or they may be going for funded IVF, or they may be private IVF, or they may be just trying to conceive naturally, and they just want to make sure they're in the best possible health they possibly can be. So your job really is to be a bit of a detective, and that's the really exciting bit for me when I work with fertility. You know, it's not, in many cases, it's not a short journey. You know, you will see someone for quite a lot of appointments generally. So it's really exciting, and it's really nice to build that relationship with your clients. Some really important considerations, that one of the key things that I've learned is make sure your recommendations do not cause added stress to the individual or the couple. You're never going to get a more empowered group. You know, this group of people that you're working with fertility, they obviously have a clear goal, and they're very, very empowered generally, but you have to still really remember, you know, that you have to work within their lifestyle. Generally, if they're first time, if they've not got any children already, they'll be working still, so they, you know, quite often I see a lot of women that have very stressful jobs, so there has to be a compromise, and there has to be a way of making sure that their diet does not cause stress. You know, I always say to people, you know, it doesn't have to be perfect, because if they're trying to be perfect all the time, they're going to feel like, oh my god, I mustn't eat this, oh my god, I mustn't eat that, and I don't think that's healthy for them. It's really exciting to be able to give a person or a couple some control back, you know, going through IVF, basically being prodded and poked a lot. You know, everything is being done to them. They don't really understand what's happening to them very often, and they're being, you know, stuff that's being done to them, and it's really nice to give them some control back. They're doing something for themselves, and to give them a little of an understanding, particularly if you have a couple that have unexplained fertility problems. If you can perhaps give them some explanation as to why they might be having those issues, you know, by doing that detective work, it can be really, really empowering for them. Some couples just need reassurance that they're doing the right thing. And some don't want in-depth consultations, as I've said, and they just want simple, easy to follow guidelines. And think about where your support ends. I mean, it certainly doesn't end at conception, and that's one of the things we've definitely found with our fertility programs, is actually then giving them a second part of the program when they're pregnant. You know, obviously if you've got recurrent miscarriages, you want to be supporting them to make sure they can hold that pregnancy. Then what about at the end? You know, have a think about how you could support them. What are they going to put in their birthing bag? You know, actually we can give some really practical advice. So things I've learned about working with fertility is, one is, it's not for everyone. You know, I did go through a period where I was, you know, doubting, is this the right thing for me? Because you don't have immediate results. You know, obviously, you know, the clear result is that they have a pregnancy and they have a baby at the end of it. You may have women that have not got pregnant before that actually manage to get pregnant but then have a miscarriage. That's a sign of improvement, you know, and it's about working with what you've got, but it's a huge responsibility, you know, and it's not for everyone. As I said, it can be exciting and it's really good to do the detective work. I think work with other therapists is really good to put your heads together. So I work, as I said, with hypnosis and hypnofertility. I work a lot with acupuncturists, and I work a lot with homeopaths and herbalists. Really, really useful. And I like to have case conferences with them, which is why I tend to try to sell a package to someone so that they've got all the therapies in there as needed. Not everyone can afford that, and not everyone wants that. But, you know, I think it's really helpful. I think it's fascinating how what we do links with what acupuncturists, for example, do. They talk in very different terms to us. But whenever I've found someone with adrenal fatigue, acupuncturists always tend to pick up on kidney energy, and obviously the adrenals sit on top of the kidneys. So it does always tend to tie together. It's a really fast moving area, and IVF, particularly, and IVF techniques are changing all the time. So really keeping on top of not only what you can do, but what the medical profession can do is really key. Do as much testing as you can. I remember when I first practiced, and I'm not in London, I'm in Norwich, where people don't tend to spend as much money. And I was also a little bit frightened with fertility of asking them to do lots of tests. But I'm now very much more, look, let's get all the information, because particularly you've got an older client, you don't really want to be kind of stabbing in the dark about what you're doing. The more information and detective work you can do, the better. So I tend to, as standard, do a hair mineral analysis and a vitamin D test, which I'll explain a little bit more later, and definitely the adrenal glands if I think that's warranted, and then if I can, get them to do a female sex hormone profile on top of that too. And do listen to your client. Actually, I find with fertility clients is that they spend a lot of time on groups, on forums. They know so much, and they know stuff that you won't know because they're just reading all the time about the latest techniques and technology in regards to fertility. So, you know, listen to them because they will give you really interesting insights. So I just wanted to take you through one quite simple case study. I saw a couple called Simon and Natasha, and they were in their early 30s. So I tend to see a couple for an hour and a half. They'd had 2 failed IVF attempts in the last year, one fresh cycle, one frozen, and they had one NHS funded cycle left, and that was coming in the next few months. One of the things I find with IVF is very often they want to rush them through. You know, they're in their early 30s, this couple, and, you know, what is the rush? My view is if it hasn't worked, let's get them in the best possible health we can. But very often you'll find that IVF clinics want to get them through as quickly as they possibly can, which isn't always the best thing in terms of success. And they can talk to them about that, and I always advise them just to see if they can have a bit of a break, you know, particularly if they're under 35. They had lots of eggs retrieved in both their cycle and several fertilized, and they did get to the blastocyst stage. There was a suggestion that Natasha has polycystic ovary syndrome. She's not had a period in 4 years, and she was on metformin. She started the pill age 20, she was on the pill for 9 years, but before she went on the pill, her periods were regular. She was told she had polycystic ovaries but no syndrome because she was not overweight and she didn't have excess hair growth. So it's really interesting. I hear that a lot, that you don't have the syndrome but you've got polycystic ovaries, and you know, people don't really understand what that means, and I don't think it's really a clarification for people. And I tend to, if I know someone's got polycystic ovaries, then obviously still be thinking about it along the same lines as the syndrome. Her thyroid hadn't been checked. It's incredible, probably about 90% of cases of fertility I'm working with, the thyroid hasn't been checked, and I pick up a lot of low T3 that's not picked up. I find in our area you have to fight quite a lot to get the NHS to fund a T3 check. They didn't really get any feedback on why the last round wasn't successful either. Interesting thing I picked up was Natasha's often constipated. She has a bowel movement every 3 days, rabbit pellets. So immediately I'm thinking about thyroid as well. She struggles to relax. Really interesting when we had a good chat with her husband, and that's why I like the husband to be there, because you learn lots of things about about both of them, I was discussing with them, and he was really like, you do way too much exercise, you do way too much. She did try a bit of meditation, but she gave up. She used to have a very stressful teaching job. Her job wasn't so stressful now, but he really suspects that she doesn't do enough exercise. Sorry, my dog's barking. It's just typical timing. I hope he'll stop in a moment. And they want to make sure they're doing all they can before the last NHS-funded test. Her diet was already really good. Bear with me 1 second, I'm going to shut the door. And I'm back. Sorry about that. So her diet was already really good, rich in lean protein, oily fish, fresh fruit and veg, whole grains, low in alcohol, occasional dessert. So when I have someone like that in front of me, I kind of immediately thinking, okay, what can I do with diet? And one of the reasons I wanted to bring this case forward was to show you that, actually there's a lot that you can do, even if it's just small changes. I asked her to get her IVF clinic to just check that her T3 and thyroid antibodies had been checked, and wanted to make sure that she'd been checked for iron, B12, folate, and vitamin D. I always think it's important to rule out what you can. As I said earlier, I asked them about whether they could slow down the IVF cycles. What is the rush? Really get them properly rebalanced and prepared. We had a really big discussion around relaxation and sleep. Don't forget, as nutritional practitioners, that lifestyle is so important. And we worked on what would really work for her. I talked to her about her adrenals as well. I often talk to people about getting a weekly lay-in. I remember reading some of Dr. Wilson's work, and he's obviously Dr. Adrenal Fatigue, as we like to call him. And I remember actually him talking about a lecture I went to that get a weekly lie-in. It's amazing how many people think that sleeping past 9 is lazy, but I really advise people when they can, particularly those that don't have children, is to lay in past 9 o'clock at least once or twice a week. And we talked about doing yoga and meditation as well. We talked about blood sugar balance. It's really interesting. Obviously, if your blood sugar is imbalanced, that may affect your adrenal health. And also insulin peaks. Obviously, if your blood sugar is high, insulin peaks may reduce sex hormone binding globulins that might release more free testosterone. So obviously, if she has got polycystic ovaries, we don't know what her testosterone level is, but it's always worth bearing that in mind. I always focus on adrenal health as well to support progesterone levels, which we'll talk a little bit more about in a moment. I talked to them about self-hypnosis, hypnofertility, massage, acupuncture, and really re-emphasize to them what they were doing right. And it was great to be able to give them, very practical advice. Things like lean protein with every meal and snack, plenty of foods rich in omega-3, 7 fruit and veg a day. And I really talk to people about how to do that, because some people really that worries them, having lots of different fruit and veg, but I'm sure you've all got lots of very practical tips you can give to people. Whole grains, no refined carbs or sugar, but I talk to them also about having a treat every now and again, and I think this is really important for fertility. I mean, how many couples do you hear of who, when they give up trying to conceive, they get pregnant naturally? I know a lot that has happened to, from clients and friends and family. I say to them, get drunk and have some great sex. That might not sound about the best advice, but sometimes, just letting your hair down, having really good sex that's not about making babies is really good. And we know, obviously, when women orgasm, that can be really good for their sex hormone release as well. I talked to her really about replenishing her body after exercise and making sure that she's not exercising on empty as well. And I put her on the best quality supplements that I can. If anyone wants to know a little bit more about what I use, I'm happy to take that in the questions at the end. So the outcome of this case study, they were really grateful for the appointment. I only saw them for the hour and a half, and that was enough for them. And the words that I had as they left my consultation room were, "Thank you so much. We feel an enormous sense of relief." It's just so good to have someone who can really help us with the practical things, and what we can do for ourselves. So I think it's important to remember that when you work with functional health, but actually just really simple practical things can be very useful. So let's move on to the importance of the adrenals. Time is ticking on quickly this morning. If we don't get through everything, obviously you've got my slides. So I think this is a really important area to work on. As I said there, I never do a female hormone profile without also testing the adrenal glands. And I thought I'd talk through that. And obviously you've got an image here of your adrenal glands. So if we just look at the pregnenolone steal, obviously cholesterol is the substrate that makes all of our steroid hormones. And if someone is running the stress response continually and has a lot of adrenal stress, they're going to be making more cortisol at the expense of progesterone. You can see that pathway there that, you know, we're going to be going down the 17-OH pregnenolone and 17-OH progesterone pathway at the expense of progesterone. And how I explain to people is I say to them, you know, that you need adrenal hormones for life. You can't function without them. But, you know, your sex hormones in terms of your life are less important. So your body's always going to be favoring, you know, supporting the adrenal glands. So really key is trying to get the adrenals as healthy as possible. And I almost feel that that is as important, if not more important, as testing your sex hormone profile for women, because, you know, I think it just gives us answers as to why there may be imbalances with the sex hormones. We tend to see this pregnenolone steal in extreme stress. You may get a real extreme trigger stress event, or where they've got quite advanced maladaptation of the adrenal glands. What this means is that they may have reduced progesterone. Obviously, that may increase the risk of miscarriage because they might not have enough progesterone to maintain the pregnancy in the first 10 to 12 weeks. You may end up with an estrogen dominant condition. If progesterone is low in comparison to estrogen, that could affect their cycles. Could potentially disrupt ovulation, increase the risk of polycystic ovaries, endometriosis, amenorrhea, adrenal fatigue, thyroid issues. Obviously think about that thyroid adrenal axis. And remember nutrient loss. You know, if someone's stressed constantly, they're going to be burning up a lot of nutrients. They could be deficient in magnesium, vitamin C, zinc, and B vitamins. So we talked a little bit about that hypothalamus pituitary axis, or the adrenal thyroid ovarian axis. You know, we have a really delicate balance alongside those axes. So as adrenal stress and adrenal fatigue advance, excuse me, we tend to see a lot of secondary hypothyroidism. I see a lot of women displaying low thyroid symptoms, but not necessarily having any issues with their thyroid levels in blood. You know, sometimes it can just be coming from the amount of adrenal stress they're having. Obviously, the body increases your reverse T3 levels when you're adrenally stressed, and the body uses it like a braking system. Obviously it's time to conserve energy as the adrenals are under so much pressure, and then obviously the thyroid is involved in metabolism, so it's a way of, you know, conserving energy. It's like it's up regulating that reverse T3. The more cortisol you have, the more in reverse T3 you will have, which can persist after stress is gone, and that reverse T3 can block how much your body is using the active T3 hormone. I often draw the thyroid chain very simply for people. They say, oh yeah, my thyroid's been checked, as you well hear very often, but I talk to them about the importance of getting active T3 checked. Thyroid is very rarely checked in fertility investigations, in my experience. Often if they do come back with low T3, what tends to happen though is GP says, oh well, you're not really got any thyroid issues because it's the T3 that's low, not anything else, and there's not really anything we can do about that. So they kind of leave that information. I've seen that happen quite a lot in thyroid cases. So do always ask for test results and get copies of test results as much as you possibly can. So I wanted to go through one of my favourite cases that I worked with. I have a lady called Claire here who is age 28, and she's been trying to conceive for 3 years. Her diet was pretty good, but it was very low in protein, and she sometimes skipped meals. And interestingly, what I found is that she'd been put on a very alkalizing diet by a homeopath. I think homeopaths are wonderful and they're great practitioners, but You just have to be a little bit careful with diets that I find people are put on, because she was finding it very stressful and she had very little protein. Her BMI was at 19, and her periods were generally regular, not heavy nor light. She had a regular cycle, but there's a lot of stress going on. She said the amount of stress we have had is unreal. Her dad was going through quite serious prostate cancer. She was a teaching assistant, had very stressful work for 9 years, and she was one of those people that's not very good with change. She sometimes gets anxious, and she admitted that. She had some very interesting symptoms like cold hands and feet constantly. She was a little bit constipated and dry skin. So obviously immediately I'm thinking adrenals and thyroid. Her partner was low in iron, so although her partner didn't want to come to see me, I did ask about his sperm results and about other test results that he had. So I recommended a good multivitamin and some iron for him as well. They wanted to support fertility naturally. She noticed that she hadn't been ovulating for 4 months. Other symptoms she said were that she was fuzzy-headed, bloating after most meals. She got lots of blood test results, all which were normal, and her thyroid had come out normal. TSH 1.75, T4 at 14, so not even really borderline. And budget was an issue, so I obviously had to spend the money very carefully, although her mum was helping her quite a lot. So look at this adrenal stress index. So, it's very clear to see for me here why she's not conceiving. She's got exhaustion stage. This is a Genova test result. I sometimes use Genova. I'm moving a little bit more towards Red Apple because I like the Dietary test and I like the support that Red Apple give you for going through test results. So you can see all of her cortisol was very low. Ideally, you want to see someone in that green range. This is quite an old test. This is about 3 or 4 years old, and they have changed the reference ranges, but I tend to go on these reference ranges more than I do the wider ones that they're now using. So her cortisol output is flat all day long, and you can see that her DHEA is starting to drop. What we tend to see with maladaptation, obviously, is initially someone will have a cortisol rise, cortisol will be high, DHEA can drop a little bit then. As the cortisol then starts to drop, the DHEA comes up to try to buffer, then the DHEA will start to buffer up, the cortisol starts to drop down, DHA may stay up a little bit, then it will start to come down and the cortisol will come down. That's one of the last things when the cortisol is completely flat. So she is clearly in exhaustion stage, and for someone of her age, her DHA certainly shouldn't be this low. So in this kind of picture, it's very likely that there's thyroid issues going on. It's very likely that she might have low progesterone. So interestingly, I did her female hormone profile with Red Apple because I wanted to get a picture of what her adrenal, her sex hormones were doing. So you've got the estradiol is in green and the progesterone is in red. So on first glance, this looks like it's doing what it should be doing. She has got quite a nice progesterone surge in the second half of the cycle, and she's got a nice estrogen peak. The progesterone could be higher. We'd like to see it more up at about 500, and it does drop off quite quickly. That estrogen peak, she's got a good estrogen peak, but it's almost a little bit too high. She's kind of almost overshot it a little bit. So there is definitely some irregularity going on there. But if in my mind, what I need to work on very much here is the adrenals. I got her to do the Barnes basal temperature test, and I've given you a little bit of information on how to do that. It's a little bit of a crude test, but I find it does give us a lot of clues. Along with symptoms, I very much do use the Barnes basal temperature test as well as a total thyroid screen if I can get them to do it. But she had a little bit of information on her thyroid from her GP. Her GP wouldn't test her T3 levels. So we did her Barnes basal temperature test, and very clearly you can see that it came back low. And I was concerned about her thyroid despite her NHS tests. So I very much looked at her her other symptoms, constipation, low energy, dry skin, and despite being on a essential fat supplement for 6 months. Now that might be due to the thyroid, that might be because she's not absorbing the essential fat supplement. It wasn't particularly top quality, it wasn't an Agenus one either. So the plan of action, we agreed, and this is something that you really need to do when you're working with fertility, is we agreed that she would stop trying to conceive for a period of 4 months. I look at 4 to 6 months, and she's got time on her side. If I've got someone possibly 37, 38 plus, then I wouldn't necessarily be wanting them to stop trying to conceive. But at her age, I thought it was really important, and I explained it to her on the level, look, if we don't stop you trying to conceive and get this better, you might get pregnant and you may then miscarry. So I really talked to her on a very sensitive level, but explained it in those terms. I wanted to get her on the best diet possible, and it was quite difficult to get her off this alkalizing diet, but I needed to get her to eat more protein to support her adrenals. We worked a lot on how she managed stress, and I got her to do some acupuncture. She seemed quite stressed and wired, tired and wired as well. She was resistant to change, and she quite often would email me and say, I can't do this, what am I going to do at Christmas? Little things like that would really stress her. So I told her to pick 2 days, whatever she wanted to eat, and really enjoy Christmas. So we put her on a blood sugar balancing diet and reduced sugar. And I really gave her as much information as I could to make it practical. I tend to try and do as many of my notes as I can with my clients, but also now I type my notes of my clients as I go, and I'll give them links to things that I want them to buy. So it's very easy. I'll find out at their supermarket and I'll give them links, or I use Amazon quite a lot, or if I'm on the Natural Dispensary or something like that. So looking at healthier cereal bars, quick meals, occasional ready meals for her. We had to just keep her with that. She didn't want to cook every night. I'd give her, ways of putting extra vegetables in that. She didn't want to give up her ready breakfast. So I just talked to her about adding protein to it, cinnamon instead of sugar, and some fruit. She was already on some supplements, as I've detailed there, and I very much thought we needed to keep her BMI up, because I didn't want her BMI to come under 19, and I'd like to see it more at 20, 21, 22 as well, so that her body's in the best possible place that it wants to get pregnant. We discussed her lifestyle and how to let her hair down, and I took her off the prenatal supplement for a short period, and I started her Dietary Adrenal Extra. And then after 1 month, I decided I wanted to give her separate glandular support and get her on a good quality multivitamin. So we used an adrenal glandular, a thyroid glandular, and I also gave her some Agnus castus tincture as well. It was very important that she agreed to use contraception and not try to conceive, because obviously the herbs. I'm less concerned about glandulars, and this is a decision you have to make in your practice as to whether you want to give people glandulars when they're trying to conceive. I would never give someone an adrenal glandular or a thyroid glandular or any type of glandular once they were already pregnant. You don't want to cause the hormone shift. I've taken the view in my practice that if that person needs the glandulars in order to be able to get pregnant, then the last thing I want to do is, as soon as they're pregnant, is to take them away. And I will slowly reduce them off over the first trimester. But that has to be a decision that you make. Safety is not being established, but then also not established that it can cause any harm. And that is one of the problems with pregnancy. You obviously can't test on pregnant women. So it's very difficult to be able to show clearly that this is safe. So in my view, I've taken the view on glandulars that for me, I know that in various cases I need to help get someone pregnant by using glandulars. I also tried her on a Nutri-Compose just to try and support relaxation. I often use things like Nutri-Compose, Relax, Zen, those kind of things, just to try to kind of balance that wired state. This is something you might find happens as well. So she went back to her GP and said, look, I've seen a nutritional therapist who says my adrenals are struggling. So what does the GP do? Checks her cortisol in blood. So she then calls me in a panic saying, GP says there's nothing wrong with my cortisol levels. So I then had to write her a long letter explaining the difference between a functional test and a blood test, which basically looked at, I was talking to her about how we're measuring functionally how well your adrenals are performing at the cellular level, how much is able to get into your cell, not what is bound by other proteins, by carrier proteins and swimming about in your blood. I tried to write it in quite scientific terms and in terms that she would understand, because I felt she probably might show that to her GP as well. So I think I got her back on board, but it's interesting, you know, how someone's confidence can just change so quickly by a test, and it's really important to explain to people the difference with those tests. So she had 4 months without trying to conceive, and she was feeling very well. She felt that she was coping much better with stress, and she was really keen to start trying to conceive again. I'd have liked to have given her adrenals a little bit longer. You know, obviously the aim was to try to get her to conceive, to stay pregnant and have a healthy baby in pregnancy. But obviously I'm always thinking about a mother's long-term health, because I see so many of those mums with adrenal burnout. You know, I'm always looking long-term, and I would have liked a little bit more time to get her adrenals better. But, you know, Claire had been trying for 4 years with no success of getting pregnant, and she didn't want to give it any longer. So I put her on prenatal nutrients. I gave her some good quality omega-3 fats, and I really wanted to get the omega-3s in to support uptake of hormones at the cellular level, so how much her body's listening to those hormones, so really important. And I said to her to continue her adrenal glandular and just finish the pot that she had, so she finished that. I didn't see her again, but I know that she had a baby in 2012 because I met her in my clinic reception. She booked in for some baby classes. You know, it's interesting, some people just don't feed back on where things are at, but, you know, it was really great to see that she'd had a baby. I thought I'd just spend a moment going through some other important functional tests. This hour is really flying, and so I'll see how we get on for time. Just with vitamin D, I do that as standard in my clinic, trying to get male and female vitamin D levels tested, because it's very easy to test. Finger prick test at home. I use City Assays, which is the NHS in Birmingham, and £30 each, and they just do a finger prick at home, and it's very easy to correct. So for me, it's just a very simple thing to rule out. Obviously, we know that couples with fertility problems often have low vitamin D status. We don't know where the cause and implication is, but I think it's just something that's very easy to correct. Hair mineral analysis test. For me, it's a really useful snapshot. I use it more in fertility than anything else, because I think it just rules out so many things. I see a lot of high copper, and I see a lot of toxic metals at high levels, and obviously those things can inhibit a person's ability to conceive, male and female. Foresight is a really good charity that will give you more information on toxic metals and conception. It's a really good resource. There's a lot of booklets that you can use. So I've got this case study of Hannah, who's 29. She's got one child that's nearly 3, and she had been trying to get pregnant with a second child for about 18 months. Over 2 years. They put her on the pill after her first child because her periods became heavy and irregular, and that was unusual for her. And she wasn't ovulating every month, and then she was about to be given a course of Clomid to help stimulate ovulation. Her blood pressure was low. She could be anxious, so already here I'm thinking about adrenals. Her cycle was a little bit long. Her diet was okay, but she had definitely too much sugar in her diet. Quite a lot of orange juice, hot chocolate, eating quite a lot of chocolate. She had Nutella, chocolate spread for breakfast, toast and Nutella with her breakfast. She'd had all the usual fertility investigations. She obviously wouldn't be eligible for IVF funding through the NHS because she already had one child, but they did do quite a lot of testing. And her husband's semen analysis came back normal. Her ferritin levels were a little bit on the low side, so I worked on getting some more iron into her. So as you can see, this is her hair mineral analysis. I use Mineral Check. I like how their tests are reported, and Karen at Mineral Check is really helpful. And you know, hair mineral analysis tests are pretty complicated, and it's useful just to talk to someone, and I still do it even to this day. You know, I say, this is what I think, what do you think? And it's just good to get, you know, a second opinion. So copper is a problem if someone's trying to conceive, because it's a natural contraceptive. So obviously what goes in the copper coil is the copper that can really can be used as a contraceptive. So when copper is high like this, it can be a sign of adrenal function. And also if we look at, adrenal function being altered, maladaptive, and if we look at her sodium potassium levels, it's the third and fourth one along. So it's not come out very clearly on this slide. The third and fourth one along, sodium potassium, you'll see that's quite low, again a sign of poor adrenal output. She was on Clomid, and I find what you have to do is, obviously I'd love to get her off Clomid, stop trying to conceive for a while, get copper out. But the problem is with that, with her, if I said to her, refuse the Clomid, she probably wouldn't be offered it again. And for her, and I see this with a lot of fertility clients, they need to know that they've done everything they can. So if she refuses the Clomid and she doesn't get it again, she's always going to feel some perhaps resentment towards me, towards the fact she decided not to have it. So I felt that we had to work with the situation that we had. She wanted to stay on the Clomid, so she therefore wanted to keep trying to conceive, which meant that it wasn't a situation that I wanted to be getting her copper out, particularly at the moment. So my view is that we've got to work on how we get her body to manage this copper rather than necessarily getting it out of the body. Other thing I see here is high calcium to magnesium. That's the first and second column, which again can be a sign of low magnesium, but also low B6 and poor absorption of nutrients. If you look across the board, hers are all pretty low. That may have come from adrenal stress, that may be her first pregnancy. Looking at her husband's hair mineral analysis result as well, you can see his arsenic's high. He's also got some other issues with his minerals, but the biggest problem I see there is arsenic. Arsenic exposure is linked to lower sperm concentration in men. Although his sperm test result came back normal, obviously reference ranges are not as high as they used to be. The World Health Organization has changed them. So with her having high copper, I want him to have high, super sperm, and he may possibly not with this arsenic. That's what I say to couples a lot. Your sperm test results come back normal, but we don't just want normal, we want super. We want those sperm to be super sperm so they can do the best possible job, swim as fast as they can, be as strong as they can, have as less defects as we possibly can. So that's a good way to explain to people why you need to see their husband even though they might have a normal sperm test result. So the plan of action, he was really interesting. He was, his views were, you're not going to get me on brown bread. But, she was trying very much with his diet, and she really appreciated him hearing my views and what I thought would help. And that gave her support. They both took on the dietary recommendations, just cleaned up their diet. For her, I used a lot of greens. I use a lot of homemade pestos when I'm working with clients. When you can, obviously get organic herbs. You don't want them to be having a lot of pesticides. But greens, particularly coriander, is quite good for chelation of toxic minerals. I also think about, getting toxic metals out of the gut as well. So think about, making sure that the gut's moving, maybe some pectin or some flaxseed. These are things that you can all use when someone's trying to conceive. I didn't put her on the full program of supplements because I knew that she wanted to carry on trying to conceive. So I did give her a good quality pregnancy multi, some organic green barley grass, which I use a lot during pregnancy, zinc, manganese and vitamin C, just to gently increase her nutrient levels. And she did really well with her diet, and she also did well with her husband's diet. She was sneaking in a lot of healthier foods. The fertility clinic increased her dose of Clomid, and we also decided to give her a little bit more B6, magnesium and chromium because she was really concerned about the copper levels and her low mineral levels. So I felt it was a good idea to give her a little bit extra even though she was trying to conceive. And she was also having some support from a homeopath and acupuncture, so a lot of detoxification support just to make sure that any circulating copper was able to come out. At the third appointment, her cycles have got much better. They're more like 28 days. So really make sure if you're working with fertility that you understand the cycle. Talk to people about their periods. What should they be like? Because some women don't talk about their periods. They don't know what normal is. You talk to them about fertile mucus. Obviously, that can be a sign of ovulation. Are they ovulating? And I don't necessarily get people to chart, but a lot of practitioners do. If you are going to chart, make sure that you know how to read it. She found that she didn't fancy any sweet things anymore. which was really good as well. And by January, she was 7 weeks pregnant. So I gradually took her off the extra supplements and I kept her on the quality multivitamin and green barley grass. And successful pregnancy, and they now have a little boy. I've not seen her again, so I have no idea what her copper levels are doing. So I think we'll finish up with the last sort of 10 minutes talking about what happens when someone's pregnant. Obviously, you can give clients a lot of reassurances during this time. You do have to be very mindful of what you can help with clients, but we can advise a lot on food. You know, I tend to see clients unless they've got particular problems once a trimester, particularly if I've supported them through fertility, because it's really good to be able to help support them as they go through pregnancy, particularly if they've got a history of miscarriage. I also really recommend that they carry on with their acupuncture as well. So common situations that you might see in pregnancy, there's severe morning sickness, gestational diabetes, thyroid issues, and anemia. I'm not going to have time to go through all of those, but I thought I'd talk to you a little bit about severe morning sickness. I don't know if you've ever worked with anyone with hyperemesis, gravidarum. Women can be so sick they can't get out of bed and they can't keep anything down. So you're not going to get them on a healthy diet very often. So it's just about doing what you can. Eating a balanced diet can be challenging, so just work with what they want. Ask them about what foods make them feel unwell. Ask them about what foods they like. So if it's dry foods, can you swap them from an unhealthy ginger nut to a Nairn's ginger biscuit that's got a little bit more whole grain in it? It can be that simple, just to try and get some kind of good nutrition into them. Blood sugar balance can really help with morning sickness as well. Again, a challenge if they really don't want to eat, but trying to get them to eat little and often. Ginger can be helpful. I tend to not give ginger capsules. I would always give ginger tea, crystallized ginger, ginger biscuits, much better than the ginger nuts. They've got a lot of ginger in the Nairn's ginger biscuits. It's a really good recommendation. Keeping them hydrated, sipping fluids little and often. Obviously, if they're losing weight, you do keep them in regular contact with their midwife and GP. Some women do have to be hospitalized. Suggest they avoid the smell of food and cooking. Acupuncture can be great. Interestingly, with acupuncture, if someone's got severe morning sickness, you want the acupuncturist to help them. But if someone has had fertility problems, miscarriages, that kind of thing, actually feeling morning sickness can be a little bit of sense of comfort for them. They don't want those symptoms taken away, so obviously do get them to discuss with their acupuncturist whether they want to get rid of the morning sickness or not, because for them it's a sign that they're pregnant. Things like their breasts aching, that kind of like pelvic pain that you can get, it's a sign they're pregnant and they want to feel that. So not necessarily always the right thing for them to have the acupuncture to take it away, but if someone has severe morning sickness, it can be very effective. There is some research to suggest that B6 can be very helpful, and those with severe nausea of pregnancy do have lower blood levels of B6. However, again, I would suggest you do your own research, because we don't know if safety has been established. If I've got someone with severe morning sickness, my view is trying a little bit of extra B6 is not going to do any harm, because they've got such severe morning sickness they can't eat anything. So I feel it's worth a try. But we still don't know 100% whether safety is established. So you have to decide what feels right for you. Pregnancy anemia is also really common, and GPs often prescribe iron tablets. Do make sure if they are on a GP prescribed iron tablet that they have some extra vitamin C, and that's fine in pregnancy to have an extra 500 milligrams, 1,000 milligrams of vitamin C per day. And then really get them on some good iron-rich foods. Lots of greens. So that's where the pesto can come in as well. Red meat. A lot of vegetarians find that they want to eat meat in pregnancy. And talk to them about what feels right for them. Dark cocoa powder, seeds. I sometimes suggest to clients that they get, there's a brand, and I can't think of the name, but they do dark chocolate covered pumpkin seed. With 1/2 portion of those, they're nearly getting half their daily need for iron. It's really good, and obviously that will satisfy that sweet craving. I mean, ideally we don't want people eating sweet things like that all the time, but at least they're getting protein and they're getting the dark chocolate. Blackstrap molasses is good. Beans and pulses. Some women do decide they want the occasional bit of alcohol through pregnancy. Again, that's their decision. I wouldn't recommend alcohol to them, but I always say to people, are you drinking anything? Yeah, I'm having the occasional glass of wine. I said, well, if you are going to drink the occasional glass of wine, swap it to a Guinness or an Irish stout and you'll get loads more iron. So, you know, I always find out first if they're already drinking a little bit. Organic green barley grass or something similar is really useful for getting iron levels up, and really supporting that mineral breakdown. So cider, apple vinegar, lemon juice, that kind of thing, perhaps used as dressings on salads and things like that. Just some general dietary advice or during pregnancy. Obviously, every woman will be given sheets on dietary advice during pregnancy from their midwife. I don't know how many of you have seen them, but there's some good advice on there, but it is quite limited. And you can really add to this with bespoke advice and bring it to life for them and make it relevant for them. You know, I talk to people about how important diet is. You know, you can affect the health not only of your child and as an adult when you're pregnant, but also the health of your grandchildren. I explain to them about epigenetics. You know, it's really fascinating and so amazing. You know, now's the time to learn to cook as well, so you can teach your child. You know, how many times do we see, you know, young adults who can't cook, and it's such an important skill as a parent to be able to teach your children to cook. So, you know, when you talk about to them, you know, obviously you're going to have a baby, you've got to wean them soon, and you're going to have toddlers around, you know, they need to be able to feed them a healthy diet. So now's the time to learn. One of the things I think is missing, some of the things I think is missing in the conventional midwife advice is focusing on the right essential fats. So oily fish, but I do get them to keep tuna to once a fortnight as a maximum. Blood sugar balancing, so they're not filling up on junk sugary foods. Adding goodness to each and every meal is something you can really teach them. You know, is it parsley in their scrambled eggs? Is it when they're cooking, putting some ground almonds in? Is it when they're making smoothies, putting a nice handful of extra fruit in? Really get them to listen to their body though and work out what's right for them. I remember when I was pregnant with my first child, I couldn't believe how much I wanted to eat chips, and I never ate chips and never really liked them, and I was always a protein and salad person. Didn't want protein and salad at all, just wanted stodge and carbs. And I find actually now that I'm working with a lot of pregnant women that they want that a lot. And obviously in the first stage of pregnancy, the first trimester, there's so much cell division happening. You know, they're increasing their blood supply dramatically. The body just wants instant energy. So, you know, if you've got a woman who typically is on has a low carb diet, you want to talk to them about getting some nice slow releasing carbohydrate back into the diet and not be afraid of the carbs. So get them on the best quality multivitamin and mineral for pregnancy that you can. I use Nutri's multi-essential one a day quite a lot because a lot of women I work with are very busy and they like it. It's one a day. I tend to add in some fish oil, omega-3 essential fats, particularly in the third trimester, but if you can get them to have it right through. Obviously you want to talk to them about baby brain. You know, obviously a lot of fat, particularly in the third trimester, is going into the baby's brain development. That will come out of the mother's brain if she hasn't got enough fat coming in her diet. You know, that's one of the reasons perhaps we get baby brain. Yes, it's tiredness and too, but you know, we need to be getting that good fat, and your breast milk should be having a lot of DHA in it. So I tend to use Hygenis products. Obviously be mindful which one you're using, because if it's got extra nutrients in it and they've already got nutrients in their multi, then you obviously want to be careful of something like the Farmeeper Maintain. Maybe you might not want to use that. I know Nina and Sophie can talk to you about the new omega-3 fish oil they've got out. Sometimes I'll use just one of the Farm EPA Restore, which is the pure omega-3 EPA. Do they need some extra superfoods? So I use superfoods quite a lot in pregnancy. Obviously, you don't want to be having anything that's going to have a hormonal effect, so stay away from anything like maca, but things like baobab powder, maybe some greens products, obviously dark cacao, really good for iron. Magnesium salts are great to support sleep and reduce cramping, so I use the Better You bath salts. A lot of women get cramping in pregnancy, so painful, I can tell you, because I had it quite a lot with one of mine. So if they don't want to get in the bath, because it can be difficult for some women when they're heavily pregnant, you know, just a foot soak is really nice. Obviously a lot of women get the cankles when they're in the last stage of pregnancy, very swollen ankles, so magnesium salts can be really good. Probiotics, a lot of research on probiotics to help reduce your baby's risk of allergy, particularly if you have allergy in your family or your partner does. So particularly in the third trimester, the Swansea baby study done a lot of research, and I tend to recommend women always have probiotics in the last trimester and while they're breastfeeding as well, and particularly be looking at if a child is born by cesarean. There's a new study come out this week actually about microflora in babies. It's in the papers this week. Obviously, when a child is born by cesarean, they're not inoculated with their mother's beneficial bacteria through the vaginal canal. So any cesarean born baby, I would make sure that they get some probiotics so mother can take, but also you can put a few sprinkles of probiotics on mother's nipples so when she's breastfeeding, and also it can go into any bottle fed milk. And when you think about supporting gut movement, a lot of women get piles when they're pregnant and struggle with bowel movement, obviously just all that weight going onto the bowel. So I use things like Lepicol. It's a really nice powdered supplement. If you can get a woman to take it, it's not for everyone. Psyllium works nicely, probiotics, and good old flaxseed, soaked flaxseed is really nice as well. So I think about the hospital bag. So you can give really practical advice at this time. Tell them about meal planning after baby arrives. I always say to them, if someone's coming to visit, the first 2 weeks of that, when you have that newborn baby, it's real snuggle time for the family. It's precious time. Tell them about protecting that time. And if someone wants to come visit, they have to bring a meal in their hand. It's a really good way to get extra meals, but also stocking up the freezer with loads of healthy meals, cooking lasagnas and bologneses and soups and stews and stuff, and just have it there ready. At hospital, it's going to be tea, biscuits, and sandwiches, and not great food very often. Some women may end up in hospital for several days, if they're induced or they're being kept in for observations. They can be there a long time. I remember my first, I had a cesarean, and I just begging my husband to bring me in proper food, and he'd bring in bowls of food, hot food for me, because I felt I really needed to recover. So, advise your clients that they can do that. They can bring their own hot food in, but also stuff to go in the hospital bag if they're in and out quite quickly. Naked bars, not something I use that often, but they do need a bit of instant energy. Labour's like doing a marathon. Healthy snack bars, so Pulson's another good brand. Oat cakes, a bit of honey to go on those, maybe some dark chocolate. Some herbal teas. I took my own squash when I went in so I could have some squash, some rock squash, and a straw. A straw is so useful depending on, whatever position you're in for labour. You want to make sure that you can keep hydrated, so a straw is really useful. Do look at, the first few weeks of breastfeeding with a mum as well. So in the last trimester, that's something that you can really talk them through. Put them in touch with breastfeeding support groups. It's amazing how many mums struggle with breastfeeding. I really struggle with my first one, and I gave up after 3 months because I just didn't get any support, and I didn't realise there were loads of support groups out there. There are, and we have at our clinic a breastfeeding support advisor who's properly trained in actually getting women. She's a health visitor, but she's had extra advice, extra training in breastfeeding. Find out if you're going to work with pregnant women. Find out about these kind of networks for them. And talk to them about keeping their blood sugar balanced so they're not just eating sugary foods. It's a bad habit to get into that a lot of mums do get into. I'm tired, I eat sugar. Talk to them about that their breast milk is only as healthy as they are, and so they really have this 6 months to be given their babies the absolute best. Make sure they're on a good quality multi. So we're running out of time, Sophie. I've put some slides here, but I'm just wondering what to do and whether to carry on.
Yep, go for it, Catherine. I think everybody's really enjoying themselves, so we're quite happy for you to carry on if you are.
Yeah, I can't see any feedback from anyone because for some reason I've just got the slides up. So yeah, obviously I can take some questions after this. So this is kind of the last bit that I wanted to go through, because I think as part of that kind of pregnancy journey, postnatal burnout is something I see so much, and it's not just that kind of 6 months to a year when we commonly health visitors are very good at checking for postnatal depression and things like that. Very often I find it comes after that, when it's 1 to 2 years, when mums are trying to go back to work, or particularly after their second or third child. you know, I don't know how many of you have had children, or know or have family members with children. It's the biggest transformation to your life you will ever experience. And for some mums, it kind of doesn't hit them until their child is 1 or 2. You can't go out when you want. All those really simple things. Life changes. And if their adrenals were struggling before pregnancy, quite often for a lot of mums, they'll struggle afterwards. You know, you've got a depletion of nutrient reserves. It takes a lot to make a baby, you know, and particularly when women have 2 to 3 children quite close together. You know, pregnancy sometimes is that trigger event for health issues. You know, for those of you that are trained in the functional health model, there's lots of antecedents, but pregnancy is that kind of real trigger event. I see a lot, you know, women that are kind of getting this delayed postnatal burnout. You know, they might describe continual coughs and colds, non-existent sex drive. I mean, that's usually tiredness, but also they just really don't feel like they've got any sex drive at all. Women find it affects their confidence. You know, they're not at work anymore, where perhaps they had quite a senior job. You know, they don't feel like themselves anymore. Of course, baby and child always comes first. I remember, I think it was Sally Child, when I was studying at ION, saying, you know, when a baby's born, out with the placenta comes a guilt pill. You know, I know that as a parent, and you know, I think it's good to recognise with mums that we all feel guilty about things, and we put our children first all the time. But you know, it's so important to remember your needs. As I explain to women, you know, getting some me time in your diary, it's not selfish, it's not you being a bad mum, it's actually you being a better parent. You can be a better parent if you have that me time, that time out. And I think it's quite a shift for a lot of parents to experience and understand that. You know, a massage a month feels like a luxury, but actually it's an MOT so that you can be a better parent for your child. So, you know, trying to get them out of that, you know, not feeling guilty when they're relaxing. And it's incredible, you know, about the amount of parents that just don't feel they've got time to play with their kids. You know, get down on the floor and play with their kids. Housework, cooking the meals, chores and stuff like that. You know, really get to the bottom of what the person in front of you is like at home. Will they forget some of that stuff sometimes and just chill out? You know, it doesn't matter that the washing's not all folded, or, you know, I see mums trying to iron underwear. You know, like, that's ridiculous. Let go of that stuff and actually take care of the really important things. And obviously mums at work is really, you know, difficult as well. You know, I kind of tell people about, you know, when we were cave women, we weren't supposed to, you know, we weren't designed to go to work, have children, get up in the night and breastfeed, you know, cook all the meals, and you know, we had much less responsibility. Obviously, I'm a working mum, and I'm not saying mum shouldn't be working, but it's just that extra load that comes on top of us. So very quickly, women can go from this kind of, you know, loved up kind of period, you know, it's an amazing feeling having a child, and it's this real kind of cocoon and loved up feeling, to kind of actually feeling, oh my God, I've got, you know, all this multitasking to do. And I think it's good to give women space to express those feelings, and it's about talking about their lifestyle as, you know, as part of your consultation, and how they manage that. So just thought I'd go through one more case study, which is a lady called Carol. She's 31, she's got 1 child, age 2. Her son has never slept well. She couldn't put him down for ages, and she had very bad morning sickness in the first 12 weeks of pregnancy. So I'm already thinking sleep deprived, nutrient deprived, a lot of previous stress, some traumatic events in her 20s, also food poisoning. She says that she feels like her immune system's not functioning. She's got constant fatigue, feel rubbish all day, every day. And it's so sad when she's got a 2-year-old that she wants to enjoy. She was one of the mums that just doesn't ever play with her child, because she's felt she's got no energy, she's got too much to do around the house. Blood pressure's low, so again, I'm thinking adrenal fatigue. Headaches, foggy head, brain fog, can't recover after exercise. You know, so she wants to lose her baby weight, doing loads of exercise, feeling more exhausted. You know, it's really common. So if she's got adrenal fatigue, she's not going to recover particularly well after exercise, particularly quite high intense cardio. A lot of stomach cramps, feeling sick, constipation, history of Helicobacter pylori, history of low iron, periods of very heavy, history of fibroids. So obviously I'm thinking, you know, let's get her ruled out for thyroid thyroid issues and iron, low iron, and always I get their B12 and folate checked at the same time through their GP, because you just want to rule everything out. Immediately I'm thinking adrenals. So she was really keen to do some testing, because she felt for her, she wants to know this is not her failing. You know, she wanted to know that there was some scientific reasons to why. Now, obviously this is not the perhaps adrenal picture that I would expect, because we're not seeing adrenal burnout here. But I think we're seeing some maladaptation. So how I explain this to her is that, you know, actually, although her cortisol is normal in the morning, look at the rest of her day. I think this is her on stress. So her, you know, on hyper cortisol, she hasn't got enough cortisol to have it high. This is her in the stress response, even though it looks normal. It's really important when you read adrenal stress index tests to read them in context of your client. So for me, I think that she's waking up in the stress response, and then she has this really big crash down. So, you know, her adrenals are not coping with the stress of her day. I would like, you know, although it's normal number 2, it's much lower in comparison to number 1. Yes, it should be lower, but it's that crash down that concerns me. Look at DHA sample 1, so that is high. Again, it's trying to buffer up the cortisol. Look at that in comparison to DHEA sample 3, which is at 0.51. Her body is crashing down. She's lacking the reserves to cope with the demands of her day. So although it's good news that she's still able to produce a heightened cortisol response, she is going towards adrenal fatigue if she doesn't change her diet and her lifestyle. So her existing diet was not too bad, although it was Weetabix, banana and coffee for breakfast every day, sandwich for lunch, sometimes some soup. There was some protein with that. Sometimes at the weekend it would just be toast and butter and crisps. Evening meals was a good home cooked meal, quite a lot of chocolatey snacks, and she'd have quite a lot of that Oasis drink to keep her going. A lot of intensive exercise. So we really started with blood sugar balancing, more protein, very practical things that she could do that wouldn't add more stress to her. You know, and this is a really important case, so you don't want to be giving her more stress. So I gave her things that she could do. So on the days that she could do it, we looked at overnight oats with some flaxseed to get her bowel moving and for protein and a little bit of fruit. On the days she had less time, we'd look at some wholemeal toast with peanut butter or rye bread or gluten-free toast. And it might be just something as simple as keeping her on her Weetabix, maybe trying her on a nut milk to see if that makes her tummy feel better, and adding some nuts for protein or a big tablespoon of plain natural yogurt. I got her to reduce exercise. This is a tricky one if someone really has in their mind, the more cardio I do, the more I'm going to lose weight. So you need to explain to someone like this that the high cortisol is going to cause fat storage. So, you know, she is not going to be losing that weight that well when she's got that high morning cortisol. And I talked about having exercise not as a slog, but as an enjoyment. So we talked about gentle cardio, going for walks with her son in a pushchair, relaxation, yoga, Pilates. We talked about having a massage. Interestingly, she was a massage therapist. She was a lecturer in massage. So, you know, I said, get on that couch and let your students practice on you if that's relaxing, or if not, go and have your own massage. And we talked about ways to support mindfulness. You know, I talked a lot about how the brain runs off in all kinds of places, and she really identified with that. You know, I think when you're doing the washing up, practice mindfulness when you're doing the washing up, so that when you're washing up, you're not doing anything else apart from focusing on the washing up for 5 minutes and shut off that noise. That might be her meditation. She said things like, I'm so stressed, I've got to plant all the garden. I said, well, your son's too, why aren't you doing that together? And she said, you know, you're so right. It's little things like that. We gave her some Megamag Energen Plus, which is a nice B vitamin and magnesium formula with L-carnitine and iodine. Following the first appointment, she was already seeing some improvement. She had better quality of sleep, still getting some headaches and a bit groggy, and she felt like she had that banging heart in the morning, which really correlated with the high cortisol. And I just changed her on some adrenal support formula, so I put her on Dr. Wilson's Super Adrenal Stress. And I received an email saying she's feeling so much better. She said for the first time she woke up in 10 years without feeling tired and wired. And she joined my 30-day sugar detox, which was fun, and I really got to kind of cook with her and teach her some ways of doing some nice healthy recipes that her and her son would enjoy. So there we go, a whistle-stop tour through from fertility right through to postnatal health. I hope that I haven't overloaded you with information. You found it all very useful and given you some practical tips. So, Sophie, are there any questions?
Thus far, we've just had one come in. So firstly, thank you so much, Catherine. That was a fantastic webinar, and I certainly, from my own very recent experience, am starting to see more and more women who are either in that pre-pregnancy phase where they're very anxious and stressed and not quite getting there, and that will carry through pregnancy, as I'm sure you're well aware, where you're kind of worried that even if they do conceive, are they in a good place to do so?
Yeah.
But more so in particular, I'm seeing a huge number of women, like you say, sort of 6 months, a year, even 2 years down the line, and sometimes a lot longer, where they've carried this, you hit the nail on the head, this guilt of being the perfect mother, and yet also the perfect wife, the perfect housewife, the perfect, manager, whatever it is, and it really takes its toll. So I think you've given such a fantastic picture and so many wonderful clinical pearls of wisdom that people can definitely carry through. And I know you've already helped me with some of my more complex cases, so thank you very much for that. So just to go through a couple of these questions, we'll try. So we've got one from Alexandra. She says she's got a client on Agnus castus, 40 drops first thing in the morning. It's the Avogel one. They feel they can't come off it as their PMS returns quite severely, even if they miss one day. Symptoms include painful breasts and pre-period depression. She's been taking it for a year and says her body is addicted. As soon as she comes off it, all symptoms return. She's wondering if it's compulsory to come off it in order to try to conceive, and if so, what's the best way to slowly wean someone off?
Well, all I would say to that is I'm not a herbalist. And I think it's
Okay.
important to recognise our limitations. And I cannot answer that question. And what I would do in that situation is that I would be speaking to my herbalist friend and saying, can you give me some advice? I think it's so important to have a network around us. I know as nutritional therapists, obviously we can advise herbs, but when you're looking at very specific cases like that, from what I know and from what my policy is, I don't want anyone on herbs when they're trying to conceive. Now, whether that's right or wrong, a herbalist, I wouldn't feel comfortable someone being on a herb that I had recommended for them when they're trying to conceive, and I would be looking at either getting some advice from a herbalist, whether they would help you out in this case, or sending her to see a herbalist. I wouldn't feel in a place that I could advise on that. And I wonder whether you should.
Right, okay. We've got another one from Lisa who's asking about sort of your very top tips for healthy breastfeeding diet. What do women need to be thinking about most?
So I think it's about getting as nutrient dense diet as you possibly can, eating little and often, and being mindful of those times when you're breastfeeding at night, because once you get baby to latch on, you don't want to be like suddenly feeling hungry and thirsty. So keep in the nursery some healthy snacks in a drawer where you can reach them. A big glass or jug of water is really, really key. If you're dehydrated, you just won't produce enough breast milk, so really important. You need about 500 extra calories a day when you're breastfeeding, but making sure that doesn't come in sugar. I think the biggest thing is that I see in women is that oh, I just got to eat what I can to get through, because they're so tired. But a lot of women become iron deficient around 5 or 6 months as well. So and babies go through growth spurts where they just want to feed all the time, and then they're not so they don't want to feed as much. So really focusing on iron rich foods as well. Making things that if they really want to eat cake, make cakes that are really super healthy. I've got loads of iron, so I use a Hemsley and Hemsley banana bread recipe quite a lot, chuck some extra blackstrap molasses in it. It's really rich in iron. It's got lots of nuts and seeds and things like that. Whatever you can do to get them to have as nutrient dense a diet as possible. So it's not that there's specific foods, although do make sure that they're getting enough essential fats in, because the breast milk does need a lot of DHA.
Great. And I think your idea earlier on about making sure whenever anyone comes to visit that they bring a healthy home cooked meal is a fantastic
Yeah,
idea. I've heard a
yeah,
lot of people say that they do that for their friends, and also
yeah,
they really, really love it, and I think it's
yeah.
fantastic. What
Makes
about
such difference.
having things like ready-made smoothies and stuff, I guess, in the freezer, maybe like a yogurt and
Yeah,
berries, or like a green smoothie, I guess, if women are really
yeah,
struggling, because I think
absolutely.
one of the biggest issues I certainly see, and I'm sure everybody does in clinic, is like you say, women just feeling as though they will eat whatever they can, whatever's lying around,
Mm,
and it tends to
mm,
be really quick, easy foods. And I think that
yeah,
definitely, in my experience, fuels the deterioration of the mother,
yeah.
definitely.
I agree, and they've got to get stuff in their cupboard that's easy to eat. You know,
Yeah.
get in there with them if you do visit them at home. You know, or giving them ideas and give them a store cupboard list and get them to clear out their store cupboard of all the junk and stuff like that. You know, it's about getting the best you possibly can in. You know, we know that if you drink smoothies straight away, then you get more nutrients. But is it better for them to have something than nothing? Absolutely. You know, your idea of freezing them is a great idea because, you know, although there won't be as much nutrition as in a fresh one, if they're going to get it and they're going to get some stuff in. Does that make sense? You know, I think it's really important. You know, we have to kind of work always with what that person can achieve and not with what would be the perfection. We're trying to get those men away from perfection.
Yeah, definitely. I agree. It's about what you can do and not worrying about what you can't do and just doing the best you
Exactly.
can with what you've got. So
Exactly.
one final question then from Annalise. She's just wondering about the website for Red Apple Clinics.
Yeah. Red Apple is based down in Wales. If you Google Red Apple, it's Caroline Edwards. She's a nutritional therapist as well, but she brings in the diagnostics tests from the States. And I think that's one of the few places you can get them in the UK. So the reason I like Red Apple a lot is because Caroline is just so helpful. Because, you know, these tests are complex to read and it takes some practice. And I went to Genova and I've gone back to Red Apple simply because of Caroline's practitioner support is just amazing. Her tests are a little bit more complex in the way they're set out. I prefer the way that Genova tests are set out for clients, but I find that Caroline's practitioner support is just brilliant.
Great. If anybody does struggle finding that information, I think Caroline is actually one of the practitioners listed on our website. So I
Yeah,
can put you in touch with her if needs be as well, and I'm
yeah,
sure you can as well, Catherine.
yeah.
That's it for questions by the looks of things. So thank you very much, Catherine. It's been really fantastic, as I say, and thank you everyone for coming. We will be emailing out the link to the recording and the slides so that you can have those in your clinical toolkits to refer back to as much as needs be. And do please email education@igenis.com if you need anything further at all. So all that's left for me to say is have a lovely rest of the day, and we look forward to seeing you all soon on future iGenis webinars. Take care, everyone. Thank you. Bye.
Thank you.